Thank you for your patient watching. Now I'd like to request Professor Dr. Apurva Mukherjee to come on the stage, our President, Dr. Sujay Majumdar, our Vice President, Professor Dr. Rakesh Kumar, our Assistant Secretary, as well as the editor of our book, Periodical Update for Diabetes Educator 2025, and Ms. Kalpana Ray, our Executive Member, as well as the Editor-in-Chief of Periodical Update for Dietitians. First, we will light the lamp. Thank you. Now, I would like to request Professor Dr. Apurva Mukherjee, our President, to say something.
Good afternoon, everybody. Good afternoon, my friends, my colleagues, my students, and most prolific participation from the dietitians and the diabetic educators, which are increasing quite significantly, which imparts a significant leap into the improvement of diabetes care in different parts of our country. So, huge applause to all of you for taking this opportunity to meet each other and to exchange the thoughts and ideas pertaining to the chronic disease care. Actually, in 2006, we started this Diabetes Awareness and you must have learned about the passion and dedication of none other than Mr. Indrajit Majumdar, who steered the whole journey of diabetes awareness and you in this part of the country to be marked its resonance in different organizations and different society, including the local ministry as well as the central ministry, to make so many suggestions made from day impregnated in the national directives of our country. I sincerely belong to DAY from day one of its initiation in 2006, and 19 years down the line, I can remember so many hassles and so many obstacles which have been overcome by sheer passion and dedication of none other than Mr. Indrajit Majumdar. I must mention our Vice President, Dr. Sujay Majumdar, is extremely effective. After coming into the umbrella of DAY, he has contributed tremendously into the different developments associated with diabetes awareness and you. Initially, we didn't think about the impression of diabetes awareness would last so long, but to the best of my understanding, diabetes awareness is to be increased every day and to every person living in this society. Somebody, adult, anywhere in our country, either having diabetes or pre-diabetes or some relatives pre-diabetes, some in-laws diabetics and some very close neighbors diabetic. So it's extremely important for all of us to make ourselves aware about diabetes because this chronic disease associates with so many morbidity and mortalities that have been discussed throughout the day, throughout the week and throughout months in different seminars and different continued medical education programs. Now in this inaugural program, we are going to release the updated guidelines for diabetic educators as well as the updated guidelines for diabetic dietitians. It's important to vouch on prevention of diabetes because it is the thorough lifestyle improvement, avoiding obesity, avoiding physical inactivity, indulging on exercises and maintaining ideal body weight, shedding abdominal fat, gives rise to so many wholesome effects, not only in glucose metabolism, but also overall vascular health, improving the blood pressure, improving the lipid parameters, thus reducing the burden of cardiovascular disease as well. If you can think of the Westerners, they could reduce the incidence of cardiovascular disease after 2099 steadily up to 2020 or so, but we didn't able to reduce the burden of cardiovascular disease in our community. This is because of the dietary habit, the physical inactivity, and the ethnic peculiarity which is there in South Asian people. We do belong to India, we do have an increased chance of development of glucose intolerance of various degree at different points of time. More so, hypertension itself is a risk factor for development of diabetes. Many of our people do not know that every hypertensive patient should be subjected for glucose estimation once in a year at least. Even if the blood pressure is well controlled with your antihypertensive drug, it is immensely important to screen for diabetes in them. Each and every hypertensive patient should be checked for their blood pressure every year. So is other different habits which I can narrate over hours, which will not be justified for the inaugural program. I just say that long live diabetes awareness and you, long live the diabetes prevention program all over the country by different authoritative bodies. But we do have a tremendous progress, and our day has contributed some significant improvement in the type 1 diabetes care, supplying them insulin at regular intervals at free of cost. And we do provide the monitoring as well as the cheap identification of so many complications associated with diabetes on a yearly basis. And the diabetes boat concept, which has traversed through different parts of Sundarban over the last 3 years, has also generated some significant amount of awareness in the rural Bengal. Any words are not sufficient to congratulate our dynamic secretary, Mr. Indrajit Majumdar, but the team as well of Sachetanata Bhavan, where our organization has got facilities for imparting so many important materials by different personnels as well as through booklets has provided some significant improvement over the near past. With these awards, I again congratulate my secretary, Dr. Rakesh Kumar. I want to congratulate my vice president, Dr. Sujoy Majumdar, who is a brilliant clinician and endocrinologist by himself, and none other than Dr. Indujit Majumdar, as well as whole team, each and every one of our Sachetanata Bhavan has contributed immensely for the progress and sustenance of our organization. I sincerely request all of you to bless us, to contribute for our progression. Thank you very much.
Thank you, sir. Professor Dr. Apurva Mukherjee, our president. Now I'd like to request Dr. Sujoy Majumdar, our vice president, to say a few words.
Good afternoon, everybody. After Professor Mukherjee's brilliant oration, I don't think I have much to add. Just have to add a few things, a few studies which DAY has done. When we're living in the city of Calcutta, we have got doctors, we have got diabetes educators, and we have got more knowledgeable patients who search the net and find out what they're supposed to use. I'll give you an example. In the last few months, we have had people who have searched on the net about the GLP-1, GIP combinations, and have asked us to prescribe those. But just go 100 kilometers outside the city. What the situation is, we have seen as a part of the DAY camps, when we did the camps in Sundarban, what the desolate situation was. In this Goshaba block, we did a few camps. I'm just giving you some summary results. We found 70% of the patients in that Goshaba block, those who had known diabetes, had an HbA1c more than 10. This is a devastating figure. And we had another camp which we did, where Professor Edward Jude, my dear friend, whom Dr. Ghanshyam well knows, and we're part of this diabetic foot group. So basically, he also came, he was part of this screening camp, and he himself did the tests with the monofilament. And there also we found more than 60% patients had established neuropathy. They did not know that they were having a neuropathy. The big problem with these patients was that the lack of knowledge. Like, you know something, and which I believe all of us will agree, that barefoot walking is something which is a strict no-no for people with diabetes. But many of these people who are working in the village, the farmers, fishers, and so basically these people, they were walking without a proper footwear. That concept of having a proper protected footwear was completely lacking. So what we decided is that we should try to spread the knowledge all along amongst these people. Just doing a few camps a month every year is just to keep them oriented that this is the sort of problems that you're going to face. And we know something, a message when told for the first time does not get home. But when you keep on hammering the message time and again, that some of it at least gets home. And some people realize. And I'm glad to let you know that some of the people who have been attending these DAY camps in the districts, they have got a better degree of glucose control now. They themselves know what problems to anticipate. Because in diabetes, the doctor is not present with you all the time. But the patient has to know this patient empowerment. It's an integral part of diabetes management nowadays. And so what we do, we teach the patients what to do, what tests to do, how frequently to do. Money is not always the shortcoming, because an HbA1c or a fasting PP does not really cost you that amount of money. A lot of these farmers or these fishermen, they earn quite a lot of money. Money is not the issue, but how to utilize the money is an issue. So that is what we have been doing here in DAY. The other important thing is the diabetes type 1 diabetes school, for which DAY won an award a couple of years ago in one of the national type 1 diabetes meets. They won the first prize there for doing this human service. We have got patients, and this is my request to all your doctors who are present here. If you have got a patient who needs insulin, cannot afford it, a type 1 diabetes patient, you can send them over to DAY. Your treatment will not be affected in any way. The DAY will provide the insulin in that way free of cost till these patients attain the age of 18 years. So that is something which is decided right now, and that's the way we intend to serve the society. DAY is primarily a philanthropic organization, and in this conference, we're just trying to spread this message around for the doctors, the diabetes educators about what's new in the field of diabetes and how we can manage the different problems. Previously, patients did not survive that long. But nowadays, with a good treatment, patients are surviving a much longer period, and you're getting more complications. So nowadays, the treatment strategy has shifted just from glycemic control to the management of the comorbidities like the cardiovascular, renal, and hepatic outcomes. Not forgetting the microvascular diseases like the neuropathy, nephropathy, and retinopathy. So we can only say that a diabetes patient is well controlled when not only the glucose control has been achieved, but all these complications have been addressed too. And that is an integral part of diabetes management, and in all the day meetings that we hold, be it DAYCON, DAYDEIC, or the monthly meetings, we try to harp on this particular message. Diabetes is something about which you have to be eternally vigilant. You cannot just let it skip off. And this is the message which should go to all the patients. The doctors, we know it, but often we do not have the time to discuss with the patients as to what are the problems. Two big issues which are often not discussed. One is the issue of functional hypogonadism, like erectile dysfunction, and the other one is the issue of depression, which often affects the people of diabetes. And in this session, we have already had some sessions where we try to address these issues. Some of these other issues will be addressed in today's conference later on in the day. And I'll request all of you to stay back and listen, because I can only tell you, you will all be enriched by this new flood of informations, which is going to be unraveled today in the afternoon. So with that, I end my presentation. Thank you very much.
Thank you, sir. Now I would like to request Professor Dr. Rakesh Kumar, our Editor-in-Chief of the Periodical Update for Diabetes Educators 2025, to say a few words.
Thank you, Idajit, and I welcome you all on behalf of DAYDEIC. And Diabetes Awareness in You is associated with diabetes education since over a decade. And I am also with this thought process since last 12 or 13 years. And this is not an organization to begin with. It is a thought process. And you can only be part of this organization once your thought process matches ours. And diabetes is more than drugs. Diabetes management is more than drugs. Drug is just a part of, I can say 10 to 20% of the diabetes management. Rest other 80% are not very common mode of treatment of the diabetes patient. Not because doctors are not familiar with it, because they don't have enough time, they don't have enough logistics, and they don't have enough training in that. So Diabetes Awareness in You started to spread awareness regarding diabetes. And 2 years ago, we achieved a milestone in publishing a periodical in the Diabetes Update for the diabetes educators. That was an official publication, yet unofficial, because we haven't went for the ISBN, because we wanted feedback from the our readers, how it is, what improvement we need. So this year, Idajit asked me to be editor-in-chief, the chief of the one book, periodical updates. The first thing I asked him that get our book ISBN done. And we got ISBN number. And this year, we have got leading experts, not only from this country, but also from our neighboring countries. Many leading authors are still in this room, sitting here, like Goyal sir, Cheryl, Shubda, Sujay sir, Naskarda, many more are here sitting here. I can tell you, although the name is periodical updates for the diabetes educators, but you will find contents that will benefit doctors also, not only the interns, house staffs, PGTs, but also those who are running diabetes clinic, because the content is so much intense that we are thinking of renaming it from the next year for the diabetes management team. Like that, we are thinking on the name. So I request all of you that this book must be a part of your library. And you must give this book to a doctor whom you are working with, not to increase his knowledge, but only to get his support that he or she understand what are the components of diabetes management. so that they will rely more on you. Unless until they understand the importance and components of different, how vast it is, they are not going to hire diabetes educators or they are not going to trust them. So this is a treasure. Must have book in your library. Gift it, come back to us with your feedback, be it positive, be it negative, what to add, what to delete. So we are open to improvement in this book. And I again thank you all and request all of you, please buy this book. We are publishing this book on no profit, no loss basis, even with some loss, just for the education purpose. Buy it, gift it, keep it, read it, get back to us. Thank you all.
Thank you, Dr. Rakesh. Our Assistant Secretary as well as the Editor-in-Chief of Periodical Update for Diabetes Educators. Now, I'd like to request our Executive Member, Ms. Kalpana Ray, Editor-in-Chief of Periodical Update for Dietitians 2025 to say something.
Thank you, Indrajit. Actually, all of you know that DAY is working in different field. Still, we think for a book for dietitian also. And actually, dietitians are from like in one place, like from Kolkata, Goria, or they telling something about diet. And again, if you go to the North Kolkata, then again, maybe other dietitian is telling for the same disease, other thing. And what in my practice, I am working for like more than 30 years in clinical field, that all dietitians should say the same guideline. And from that feeling, we think for this book. And successfully, we published one book in 2023. Now, already Dr. Rakesh explained that we have got the ISBN number also. So, this book and all of us like Dr. Anindita, then Sumunadi, then Mitali, then Ipshita, and from Mr. Shiv Shankar from Bombay, and many other like Orpita also, Komal also there. They are all contribute in this author of this book. And my heartiest thanks to all of you, all the author for this book. And these guidelines are like latest and correct guidelines. And for practitioner who are practiced in as clinical dietitian as well as diabetes educator, and for students, it will, I think, it will be beneficial for all of you. Thanking you, and please go through this book. Now our book will be inaugurated. Thank you.
Thank you, Didi. Now, I have to share something. You know that we are giving the Best Indian Diabetes Educator Award. We have instituted this award in 1920. Actually, we given the award first time in 2020. So this year, on the 5th of September, on the International Diabetes Educators Day, this is a virtual program. We have a rigorous process. We are getting nominations from all over India. We have the juries from all over India. So we have declared the award on 5th of September. Before moving to that, I am again reminding you that that is our slogan. 15 years back, we have launched it. And on last World Diabetes Day, we have revised this slogan, বয়স হলে 25 বছর ব্লাড সুগার টেস্ট প্রতি বছর, গর্ভবতী হবেন যিনি দেখতেই হবে তার চিনি। Positivity test blood sugar before pregnant you are. That is most important. You know that GDM is a big issue in our country. Almost 1/4 of pregnant women are suffering from the GDM nowadays. This is our another campaign, hashtag better living with diabetes in India. Please join us in this movement. Now, this time the Aishwarya from Chennai, Tamil Nadu got the Best Junior Indian Diabetes Educator Award. And we are very proud that the senior category from our own city, our loving city, Kolkata, Komal Srivastava has got the Best Senior Category Award. And this year we have also instituted the Best Mentor. Dr. B. Mohan sir was a mentor because he is the mentor of the Aishwarya. Actually, Aishwarya attached with the Dr. Mohan's Specialty Center, Chennai. So we have started this award for the best mentor from this year. Now, Komol is our very own city, Kolkata. I would like to request Komol we will hand over you the award here, taking this opportunity. I would like to request Professor Dr. Apurva Mukherjee sir, Dr. Sujay Majumdar sir. We have a check of 10,000 rupees, a certificate and a gold medal. A big round of applause. In the final category, there are 4 final nominees, one from Chennai, one from Kolkata, one from Nagpur, and another from Mumbai. So, the 5-member jury board have selected Komal Srivastava as the best senior Indian diabetes educator. Our judges we are very grateful to them. Our judges were Miss Deepti S, diabetes educator from Bengaluru, Dr. Rutul Gokalani from Ahmedabad, Dr. Monisha Gupta from UP, Dr. Supratik Bhattacharya from Kolkata, and another one, I just forgot the name, to remember. Ila Majumdar Memorial Research Grant for Diabetes Educator to Miss Bijaya Das and team. This research grant is exclusively for our members. So Bijaya is absent today. So from her team, two representatives are present here. Please come on the stage. I'd like to request Dr. Sujay Majumdar, Apurva Mukherjee sir and Sujay Majumdar sir, please come on the center stage. A research grant of 30,000 will be given to them. Our broad area is the social stigmas. And second, Professor Dr. Rashid Baron Sandal Memorial Research Grant for Dietitian Nutritionist. This year, our expert team have selected Dr. Suprakash Pradhan and his team. Dr. Suprakash Pradhan. Dr. Suprakash. ও তো জানি তো কোথায় ঠিক সময় থাকে না ওকে উই উইল হ্যান্ড ওভার দ্য অ্যাওয়ার্ড লেটার অন it is an announcement we have curated a course for general people for the PWDs now in the trial run phase. Our partner is Hollows Healthcare Foundation. So from the Hollows Healthcare Foundation as well as Day Diabetes Awareness, and we are announcing that we are going to the trial run and we are giving an opportunity for the delegates of DAYDEIC to do the trial run. We'll share the link at the rate of only ₹99, a 5 hours interactive session. We'll provide the link in the delegate group and the link will be closed by tomorrow midnight. Please remind that tomorrow midnight link will be closed. Before that you can enroll in the this interactive course in the trial run at the rate of ₹99 only. Now the book. Before this moment, I would like to request Dr. Suprakash. Please come on the stage. Dr. Suprakash Pradhan and team has got the Ashit Baron Shandal Memorial Grant for the dietitian this year. We will provide the 30,000 research grant to them. Before the auspicious moment of the book launch, I would like to request our very own T1D friend Snehadita here for a Ganesh Bandana. Snehadita is a fantastic singer. She is our T1D in the support group as well as very active T1D member of our day. Start.
Good afternoon, everyone. My name is Sneha Chatterjee. Today I am going to represent a Ganesh Bandhana. Today I am going to represent a Ganesh Bandhana. गिरिजासुत लंबोदर गिरिजासुत लंबोदर एकदंत गजानन एकदंत गजानन विघ्नहरण सिद्धिदायक विघ्नहरण सिद्धिदायक मन इच्छा पूरन करत गिरिजासुत लंबोदर गिरिजासुत लंबोदर जो ही करत ध्यान सो ही फल पावे जो ही करत ध्यान सो ही फल पावे सिद्धिदाता तेरु नाम सिद्धिदाता तेरु नाम सुर नर मुनि गुण गावे गिरिजासुत लंबोदर गिरिजासुत लंबोदर एकदंत गजानन विघ्नहरण सिद्धिदायक मन इच्छा पूरन करत गिरिजासुत लंबोदर गिरिजासुत लंबोदर गिरिजासुत लंबोदर.
Fantastic.
Thank you, everyone.
Fantastic. Snehadita, एक मिनट द्वारा. Token of love from our end to Snehadita. Give it by Madhumati De. Now the moment we are going to publish. Before that, I would like to invite all our chapter contributors in the stage. Please, Seril, Shubda, please come on the stage. Anurada, Mitalidi. Sir, Goel sir, চলে আসুন স্যার. রেখা দি. আমি কাউর নাম মিস করতে পারি. Who have contributed the chapters? You know the best. অনিন্দিতা দি, সুমনা দি চলে আসুন. For booking of books, we are now giving the discount of 50%. Please book the book by today midnight, because this discount will be no longer there. Because our book will be available in the Amazon also. Sir, হ্যাঁ হ্যাঁ ঠিক আছে। না বইগুলো আমাদের ফেরত দিয়ে দিতে হবে, কারণ আপনাদের জন্য পুরো ব্যাগে ভরা আছে, একদম রেডি করা আছে, সবাইকে আমরা ব্যাগে করে দেবো। Thank you. Taking this opportunity, I would like to extend our heartfelt thanks, gratitude to all chapter contributors. Without you people, we can't do it. Again, our book will be published in the year 2027 because we have a periodicity of 2 years. Thank you for you have already booked the book, and there is opportunity to book the books at the rate of 50% discount rate till today midnight. You can find the link in the soft copy of the brochure embedded there. Please, those who have missed, please do the booking. থ্যাংক ইউ, থ্যাংক ইউ। আচ্ছা হাততালি পড়লো না, বলতে হবে, আমরা আমাদের খুব সমস্যা হয়ে গেছে, আমরা এই মোবাইলের যুগে না হাততালি দিতে ভুলে গেছি, মানে এটা খুব সরি, ডোন্ট গেট মি রং। So we have now lunch. There is an arrangement of lunch in ground floor as well as first floor. Please take your lunch at the convenient, but we are again start the session just after. দিদি এই ঝামেলা বাড়ি আমরা ঢুকবেন এর মধ্যে, আপনি বইগুলো ফেরত